Hi everybody, welcome to the 5th episode of Come Back to the Sacred Nature of Birth. Today I want to tell you all about the cesarean section. Everything you should know, in my opinion, what you should know before you decide for this operation or before you decide to have birth, to give birth in a hospital, so you can understand how to navigate it in case you end up in an emergency C-section. And while I'm not against C-section, and I do understand that it's an operation that at times saves lives of women and children. However, I think that in our times, rarely we do think about what is the full spectrum of the consequences that are connected to the cesarean section. And I think it's unfair to present it as simply as an equal alternative to natural birth, or sometimes as a more comfortable birth in comparison to the natural birth. And I think that there should be some more thoughtfulness around the topic of cesarean section. And while I understand why so many women can and want to decide for C-section, planned C-section, I do understand the reasons, I do understand the fears, I do understand the traumas that run in our lineages. Sometimes it connects to a child loss, sometimes it connects to some serious consequences after or complications after natural birth. And even at times I do support women who opt for planned C-section or who end up in having a C-section. And yet I still believe that we should take this decision very thoughtfully and understand how it affects not only mother but also our child. I don't think this kind of education is truly accessible for us, even online. I don't find a lot of this information in the mainstream, and some of it that I came across in Michelle Odon's book I found truly fascinating. And some also come from the interview with the birth educator that I cooperate with in Poland here. Her name is Magda Kozicka. And what I want to add in the beginning is that most of the research that I'm going to base on today do not establish a clear causal relationship, but rather show a correlation between different factors. So it's not a deterministic, so these are not deterministic theories that show that this must happen when we have cesarean section. It's rather a correlation and showing that the level of probability rises with choosing C-section. The first thing is anesthesia. So the anesthetic may contain fentanyl, which is a substance like an opioid, and it's a very powerful substance. There is a common belief that the anesthesia doesn't reach baby. However, it can cross the placenta and affect the baby as well. The mother may experience feeling of numbness, mental fog after anesthesia, and the baby may also be affected after the birth. Especially in the environment of birth educators, there is a lot of discussion around it, and women are showing that women are noticing that children after anesthesia behave differently in the beginning. Yes, after the birth, that they are not so present, they are a bit foggy, they are not really reacting as well as and they are not as active as children after the natural births. Anesthesia may also, but not necessarily, contribute to breathing difficulties in the baby after birth. So, common that the baby needs to be suctioned. The fluid from the lungs needs to be suctioned after C-section. Okay. The open wound in the mother. So the cesarean section leaves the mother with a surgical wound, which carries a risk of infection. That's why antibiotics are often administered. And these antibiotics can affect the bacterial flora of both the mother and the baby. What else is that after the cesarean section, we are often also given painkillers, of course, to just manage the pain because it's quite strong. And we now know that it also affects the babies. The baby's microbiome. So as the baby passes through the birth canal, it comes into contact with the bacteria along the way. Those bacteria can contribute to the colonization of the baby's gut and the development of the microbiome. And with the cesarean birth, this process is largely bypassed. So some hospitals now do use vaginal swabbing, where vaginal bacteria from the mother are transferred to the baby after birth. But it's not so common yet, and you really need to sometimes in Poland, at least, you need to a bit fight for it. So it's also good to prepare for the cesarean section to have these kind of options. Baby born by cesarean section initially develops the microbiome largely from the bacteria present in the hospital environment. So this generally affects the quality of the microbiome that the baby will establish, and it can be associated after with a higher risk of certain conditions such as allergies or asthma. And it is quite common now that women speak about it, and in this environment of birth educators there is a lot of talk about the allergies that and there is quite much research on it also about on children after cesarean sections, born by C-sections, in correlation to allergies presence. One of the biggest consequences of cesarean section that is quite known already and quite recognized by many is the breastfeeding problems, that it really reduces our chances for successful lactation. It's not, again, deterministic, but for many women, the beginnings of this journey of breastfeeding after cesarean sections are much more difficult. And there is research showing that women who gave birth by cesarean section, they breastfeed shorter than the women giving birth naturally. Just imagine after the cesarean section, you are just in so much pain, and also all the hormonal sequence, all the hormonal release, of the birth hormones, especially if it was planned C-section, is completely disrupted by anesthesia, and then the bonding with your child might be much more difficult, so you don't have this release of oxytocin, which helps you to bond, to feel the love to your child, and helps you also with the start of lactation. And even such simple thing as just the feeding of the baby can be more difficult and more painful because of the wound, and that you need to hold your child on your stomach. So what is really interesting that in Michel Audon's book, he's mentioning research that proved that the composition of milk of the mothers who gave birth with a cesarean section planned or emergency C-section is different. What does it mean? That if we are planning the cesarean section, and it might happen, usually we plan it around 1 week before the due date, and if we think about it, that the due date is not precise, and it can be around 2 weeks even before the baby really decides to arrive, sometimes even 3 weeks. So if we think about it, and the planned cesarean is 1 week before, so sometimes we can reduce the time for our baby, the time in the womb, even about a month or 3 weeks. It's almost a month. It's a lot of time for the baby to mature. And it's also interesting that the quality of the milk, we can say the composition of the milk, is different after this birth through cesarean that was planned, the one that happened after the spontaneous labor began, because of the full activation of the hormonal cascade of labor. So the same thing before, that during vaginal birth, as the baby passes through the canal, the chest of the baby is compressed, helping the fluid to be expelled from the lungs. And after cesarean section, what I mentioned before, sometimes it requires suctioning or other respiratory support. About skin-to-skin contact, sometimes it is possible and it is allowed to have a skin-to-skin contact right after the cesarean section. However, it might be also more difficult immediately after because of all the interventions that are needed and monitoring that may be necessary around the mother and the baby. Another thing is surfactant, which is a substance that helps the lungs to mature. It is a part of the process that signals that the baby's lungs are ready for life outside the womb. When a cesarean section is performed before spontaneous labor, babies are more likely to have less mature lungs and a higher risk of respiratory difficulties. The hormones involved in labor, it is also something that Michelle O'Donnell was speaking about. They play an important role in the baby's adaptation to life outside of the womb and the neurological development. So there are some interesting theories that babies adapt differently to the space accommodation, and also sometimes they can develop some sensitivity, like hypersensitivity problems. One of the things that is very common after having a cesarean section is that many babies struggle to suck milk properly, and it can be connected to the jaw tension. So while moving through the birth canal, the baby is compressed, right, again, and it's a very strong sensory process. So the nervous system develops differently. The vagus nerve is stimulated, all the fascia is stimulated. So if we were deprived of all of this stimulation, then babies can develop a lot of jaw tension and some problems with the hypoglossal nerve, which is involved in tongue movements and therefore plays an important role in breastfeeding. So because of this, some babies born by cesarean section may be incorrectly diagnosed with a tongue tie, when the underlying issue may actually involve the way the whole system was activated during birth. One of the things that really touched my heart when I was reading about it was about the baby's sense of smell. So a baby born by cesarean section may also have a less mature sense of smell. And why is it so important? Because smell is the only way, really, and also touch, but smell is one of the biggest ways, that the most important ways that the newborn recognizes their mother. And so after birth, if the baby cannot immediately orient itself through its mother's smell, this may contribute. This just causes a feeling of complete, being lost and confusion and disorientation and just a lot of loneliness. And I've been also working with people with the prenatal and very early memories, and our bodies do remember all of these first moments of our life and how we came to this world. It does really have an impact on us, and there are many therapeutic methods already now that recognize this importance on our life, and there are many methods who are working with the rewiring of that birth stories that we carry in our bodies. And finally, the mother's physiology. So there is also the mother's body to be considered. A cesarean section, of course, involves cutting through all the layers of fascia and abdominal tissues. And what is interesting when I work with women after cesarean section is that this operation, this surgery really affects how we function after. And I mean, the digestion changes, the range of movement, the way we feel in our bodies, and it can also be connected to the fascia system, which was disrupted, and which is responsible for connecting our tissues and our different organs. So these are just some facts that I've chosen to present you here. I strongly recommend you to read any of the Michel Audin's book on birth, on pregnancy, on cesarean section also. It is such a source of wisdom, and what I like about these books is that they are not only scientific, which speaks to our rational part, but there is also a more philosophical side to it, and I love these questions that Michel Audin is offering us, which are confronting us with really the future of our species. He's proposing a question that is really confronting us with the fact that we are in the middle of a big experiment as a species, because in some countries like Poland, where I am from, the cesarean section rate in some of the regions became as high as even 50%, which means 50% of our population in these regions come to this world in a new way, in a not natural way, in a not fully researched way. We don't even know yet the full spectrum of consequences of the cesarean section. I'm sure there will be much more evidence and research done in the next years. And what is truly moving for me in his books is that he's speaking about oxytocin as the only hormone that teaches us how to feel love. And he really highlights that love, we cannot feel the emotion of love with our mind. It's not something rational, but rather physiological, physical, biological. It is in our body that we feel the sensations of love. And so if we follow the theories that say that the levels of oxytocin that we will enjoy, experience in our whole life are set at the time of our birth. So what does it mean? So if we came from these cesarean section births, it means that the levels of oxytocin available to us are lower than people who came here with a natural birth. And it is controversial and it is radical, and to tell you the truth, I'm in a healing space for a long time, and I'm sure we can come back to the full spectrum of our ability to love, but how much time does it really take us? As a healer myself and as serving people in these healing spaces, I see how much effort it takes us to come back to the wholeness, to the totality of our energetic body, of our physical body. And if one of the ways to establish this wholeness is the birth, is the moment of birth, so how can we serve our children the best as we can? So following this episode, I would like to ask you another question. I would like to trigger in you another doubt, which is about generally the whole concept of medicalization of birth. Where does it come from? If the nature design is so simple and it's supposed to be so obvious and peaceful and easeful, then why we came so far? Why we developed such a technological approach to the way we are born to this world? And this you will get to know in my next video, which will be all about the history of the birth medicalization. See you there.